We're at HIMSS 2015, and we are so honored and excited to have Karen DeSalvo, the National Coordinator, with us. And we wanted to talk a little bit about the history of the FACAs. As you know, Stan Huff is one of the original members of the HIT Standards Committee, and yours truly has been a member of the HIT Policy Committee, and we've seen a lot over the last few years. So we thought maybe we could discuss briefly kind of the history of it since David Blumenthal, Farzad Mostashari, and now with Karen. And then maybe talk a little bit about your direction, Karen, relative to the committee. So, Stan, thoughts?
Well, I would just say that it's been an honor to serve. I've learned a lot. I hope I've contributed a little bit, but it's been an honor, and I think we've done some good things. And you always look back and say, well, we could have been smarter, we could have done better. But overall, I'm very pleased. It was an honor to serve, and I was excited to serve, and so I just appreciate it and express that to you. And I express as well my appreciation for your leadership. But I'm excited that you're where you're at, and it's been wonderful to have you as the new coordinator. So I appreciate that as well.
Thank you.
Yeah, I think it's been an amazing progression. You know, where David Blumenthal was there, we just had ARRA passed, and we had a real task to do to spend a bunch of money.
Yes.
And really come up with what meaningful use was.
Right.
And there were a lot of debates, as you know, Karen, right at the beginning about, should it be function features, should it be outcome driven? But I too, I've been honored to be part of that process and really learn it. It's not something I came from, politics, or even working on a FACA. You've had a lot more experience than I have. But it's been an honor to understand the process, grow through it. Paul Tang's done a nice job providing some guidance and leadership. And Farzad came in, I think, brought some excitement to it. We're already on course, but he continued that course going, and now we have Karen. And I echo what Stan says. There's been a notable shift around, it isn't just about features, it isn't just about meaningful use, it's really about people and how we best care for them. And I really appreciate you, and I really appreciate the focus that you have on interoperability and standards and the things that you've not had an opportunity to talk about. So, what have you seen, and where do you see this going?
Well, let me thank you both for your service. This is for people who haven't been involved in government, or even the FACAs that ONC has put together. They should know it's an enormous amount of work. The volunteers that we rely on for their technical expertise, for their frontline view, for their ability to keep us straight, to tell us when we're inside of our echo chamber and not really listening to all the signals and cues about what the world is like. It's really such an important part of the work we do in the way that we develop policy. So and you all, as FACA members, devote a lot of time, and so we're thankful for that. You two in particular, great leaders, really setting the tone in the conversations that I've had the chance to participate in, making sure that people are being measured and thoughtful, and really, as you say, advancing the health for everybody. I was new to the FACA experience when I became national coordinator a year ago, so like you, Mark, this was new for me. And in particular, I think the notion that we made a choice at ONC that everything would be in the public domain, so there would always be opportunity for there to be a transparency in the work that we're undertaking. The challenge for that always, in the volunteers and others, is for them to remember that this is really being done out in the public, but I think it also gives the community we're here to serve, that's everyone, a chance to participate and to weigh in. I think also what folks need to understand is that this is our principal way of getting consensus. This is how we pull the smartest people together and help us know what the guideposts are and make some recommendations to where we ought to move forward. So I've loved the process because I'm more recently from public health and from public service there. It's been a great chance to do what we did on the ground in New Orleans, but also do that at a national level, and we just really couldn't do it without.